Well, good morning, almost afternoon. Thank you for joining us today. I'm glad to be here to highlight the important work of the Idaho Foodbank and their 400 plus partner organizations in all 44 counties. Many Idahoans have experienced a job loss or loss in income since the spring, making it harder to afford the most basic of human needs, food. As a result, more and more Idaho families are turning to their local food banks and food assistance programs during the coronavirus. For a child, hunger makes it hard to focus and hard to learn. Hunger affects a child's emotions and overall health and inhibits their ability to achieve their full potential. You may be surprised to know that almost half of Idaho Foodbank's partners are schools, where backpack food and programs in school pantries feed children during the school week as well as on the weekends when they're at home. The demand for food assistance is on the rise, and I want to commend the Idaho Foodbank and its staff and all its supporters for rising to the challenge this year. Since the onset of COVID-19 in our state, the Idaho Foodbank has added more community food distributions to supplement their regular level of community support. However, it quickly became apparent that we could not sustain the level of service with the current resources, and help was urgently needed. That's why the state of Idaho just approved $2.5 million in coronavirus relief funds to support the Idaho Foodbank and families in need all across our great state. Our Coronavirus Financial Advisory Committee voted 1 week ago to approve the funding request, and I approved the recommendation on the same day. Karen Vaught, the President and CEO of the Idaho Foodbank, will talk in a minute about the far-reaching impacts of these additional funds. Karen, I appreciate you hosting us today, and we thank you for all your leadership. I want to acknowledge two legislators in attendance today, Representative Rick Youngblood and Representative Melissa Wintrow. Thank you for joining us. The additional funding for the Idaho Foodbank would not have been possible without their urging and support. Thank you, Rick and Melissa, for supporting Idaho's families in need. I'd also like to provide Idahoans with an update on COVID-19 metrics statewide. Idaho will remain in stage 4 for another 2 weeks because the number of hospital admissions of suspected and confirmed COVID-19 patients is higher than we'd like across the state. However, over the past 2 weeks, metrics have improved in other areas. We're seeing downward trend in overall confirmed cases, test positivity rates, and emergency department visits of patients with COVID-like illnesses. We have sufficient ventilators, ICU beds, and hospital PPE statewide. And the number of people admitted to hospitals is stabilizing. This demonstrates our efforts to preserve the healthcare capacity and slow the spread of coronavirus, that those efforts are all working. And I'll refer to my much-loved graph. Canyon, Ada, Kootenai, Bonneville, and Twin Falls counties continue to be hotspots for virus activity, and I support mayors and public health officials in their decisions to mitigate spread at the local level. Being here at the Idaho Foodbank reminds us that hardship is an opportunity to love your neighbor. I'm so impressed and touched by the hundreds of Idahoan citizens, businesses, and nonprofits that have stepped up to help others in need. One of the best ways we can resolve food insecurity is to control the virus and bring down the number of cases in Idaho so Idahoans can get back to work and our children can go back to school for in-person learning. Please continue to to practice all the preventive measures we've been talking about. Wear a face mask in public. Wash your hands and clean surfaces regularly. Keep physical distance from others and stay home if you're sick. Thank you. And with that, Karen Vaught, the president of the Idaho Foodbank, will say a few words and then we'll take your questions. Karen?
Thank you, Governor. It's certainly an honor to have you here with us at the Idaho Foodbank today. And I'd like to also join you in thanking Representative Wintrow and Representative Youngblood, Alex Adams, other members of the Coronavirus Financial Advisory Committee, who were involved in considering our proposal and approving the proposal to provide the assistance for Idahoans who are struggling with food insecurity. Of course, I'm here today speaking on behalf of the Idaho Foodbank and saying thank you, but I also want to deliver a message on behalf of an even larger group. The Idaho Foodbank is a statewide nonprofit organization, but we certainly do not work alone. As the governor mentioned, we work with a statewide network of more than 400 partners. In addition to the schools, these include local church pantries, shelters, and other nonprofit partners who dedicate themselves to helping their friends and neighbors during times of need. At the onset of the pandemic, these organizations quickly modified their processes to ensure the safe distribution of food. And they met their neighbors with a smile and the reassurance that they would be there, that they would be open to provide them with food until they didn't have any more food. And having that kind of assurance for those individuals is significant. Just to know that somebody is there in your local community to provide that assistance helps with the stress relief for sure. These organizations, along with the schools, are our community heroes. We appreciate their dedication and their endurance to work through whatever challenges are in front of them. They also appreciate the state's investment in the well-being of Idaho's communities. We know these are unprecedented times and they're creating hardship for many people in our state. With the sudden loss of a job or the reduction of work hours, many people are facing challenges and don't have any predictability of when that will end. And now many families are struggling with the unpredictable school schedules. We think about the parents who are working during the day and have to figure out how many hours of work they can afford to miss so that they can be at home to assist their children with online school during the day. This is in no way intended to be criticizing the schools. As a former elementary school teacher myself, I can appreciate the pressures, and I'm impressed by the work that the schools, the teachers, the administrators are putting into identifying the best way to serve our children. Nonetheless, the pressures for our families are real and the burden is heavy for many. With our network of partners, we have faced the challenge of COVID-19 by being adaptable and resourceful. Since the beginning, the Idaho Foodbank and our majority of our partners have maintained uninterrupted services. We've worked together to monitor the increasing levels of food insecurity at a county and community level and dramatically increase the amount of free food that we're providing across the state. As an example, the food bank has added community food distributions in 15 different communities each month to supplement our regular programming. Some of these community food distributions have served 1,500 households in the span of just 4 hours by using a drive-through system. Seeing the long lines of cars has definitely confirmed that we are experiencing increased food insecurity in our state. As families are facing these daunting challenges, we must be there to assist. As they review that tight budget, trying to make the difficult choices of what can and can't be paid, our message is this: apply for Idaho's emergency rent and utility assistance, right, Representative Wintrow? Yes. And pay whatever may not be covered. Pay for your medicine so you do not jeopardize your health, and let us help you with the food. Access to healthy food is a fundamental need for everyone, and the commitment of the Idaho Foodbank is to ensure this need is met across the state. The funding provided to the Idaho Foodbank will ensure that we are able to acquire and distribute healthy food to our communities and partners and directly to those in need. In light of the continued uncertainty and the stress created by this pandemic, this will allow us to ease the burden of Idahoans and reinforce good health through the assurance that food will be available for our children, our seniors, and our families. Thank you for your generous support and for the confirmation that Idahoans really do take care of each other. Thank you, Governor.
Okay, questions? Betsy.
Governor, the metrics show that most are actually improving and things are on a downward trend, but the overall numbers are so much higher than they were in the spring, and as you said, higher than where you want them to be. The only metric we didn't meet this time to move out of stage 4 was hospitalizations. Do we have the right metrics? If we're really, really high, but we just go down a little, does that mean we're doing okay?
You actually bring up a subject that we talk about all the time. Our whole goal is to maintain the delta between the blue curve and the red line. And so every time that something changes, we look at it. Originally, ICU capacity is what everybody, if you remember the state of Washington, I remember being on calls with the federal officials and Governor Inslee that ICU capacity was the most critical issue. Now hospitals treat these patients differently, so we are constantly looking at. Matter of fact, one of the metrics we did change just this month. Is that right, Dr. Hahn? But we want to get out to people that we're looking at a change in metrics, that we're thinking about changing it, we're changing it, because occasionally, I know this will be shocking to you, the media is critical if they don't understand where the numbers come from. That was a joke. So we are constantly looking at, does that metrics really measure our healthcare capacity going forward? The numbers are getting better, but not near at the rate that we would all like to see it. But you can't argue with the success that we're having. We just need to have that success at a faster rate. But we talked this morning about one of the metrics that coming up we may refine. One of the issues, I'll give you an example, is healthcare workers, and the way this works is the fact that we get a positive test, and then it takes a while for our tracing personnel and other people to find out whether they were a healthcare worker. So in essence, that's a lagging indicator that is probably lagging more than we'd like to have current information to make these determinations. But you ask a really good question, and it's something we work on all the time. Another issue that just we think, we're just getting that data, is that originally it went to CDC, then it went to HHS, and now it's going back to CDC. And we're fine just as long as we know where the data is. And of course, the reason HHS did that was because the rationing of remdesivir, they needed to know where that capacity is, because that's a real critical component to get out early. So, as again, this is the novel coronavirus, and we're learning about it every day. So what we measure is what we think basically reflects how we preserve that healthcare capacity.
In your remarks that you are supportive of mayors and public health officials at the local level in their decisions to mitigate the spread of this virus. But public health districts told your State Board of Health and Welfare yesterday that across the state they have faced protests, threats against their employees, lawsuits. I believe in the Panhandle their office has been graffitied. There's lots and lots of pushback against them. How are you supporting them when they're facing that kind of pressure?
Well, I would let you ask the health districts about how we're supporting them. We are in conversation with them multiple times a week, if not daily, about what we can do to help them in any way, shape, and form. They are, by code, for 50 years in Idaho, they are basically, and those are locally elected. One of the things that's kind of lost is that the bulk of the probably 80 to 90% of the board members are county commissioners that are elected, duly elected. So they're not some faceless, nameless bureaucrat that we've got buried in the bottom of the Capitol building. They're people that are out there that run these health districts that see their neighbors every day.
I have 3 questions from CBS student Scott Logan.
Oh, that's so unlike him.
The first question is, Idaho is reportedly the last state to apply for federal pandemic EBT funds. Why was Idaho the last to apply? And how will this money help the children of Idaho's unemployed?
Well, part of the reason it took a little longer is, and this is me saying, don't put this on the Department of Education and the school boards, is that we wanted to stay with the qualifications, and we literally had to go to every school district and say, how many kids have you got that qualify in that area? And so that and that was one of the reasons that our request was basically received and approved probably faster than, is that right, Dave? It was one of the fastest ones. It's going into place, but there's a little complication with this program, and the money's going to go out Tuesday. Starting Tuesday, the money's going out, but it's different. We've got all these school districts. Some of them are in person, some of them are remote, and if they're not at school, then that money goes up. So we got to put a system in with 150 different school, and of course that's just school districts. In some districts, some schools are at work and some aren't. We've got to comply with the law. We've got to tell the feds who put it into our system that's over the EBT system, which gives them credit on their card to buy more additional groceries, food. We've got to put that in place. So it's a little complicated, and that's why it took some time. But some other states are having problems with it. We would have liked to have done it earlier, but it's in place now.
Characterize how that'll help. These funds.
But more, Karen just talked about the challenges that people have, particularly people that have lost their jobs, or people that have jobs that their income's way down. They might be at a restaurant, they might be working for tips, and anybody in the hospitality industry, in a lot of these industries, their revenue's down, so money to pay for food is critical.
Second question is, Idaho could end the fiscal year with $503 million surplus tax revenue. How will that surplus be used? Specifically, how will it be used to help Idaho's unemployed?
Well, our unemployment, which, thank you, Scott Logan, wherever you are, for asking that question. Our unemployment numbers just came out, and we've dropped down to 5%. And in fact, that still puts us where only 2 states are doing better than Idaho. So the ultimate goal is to have the least amount of people on unemployment, and that solves a lot of problems. As you well know, we just announced last week that we've signed up for the new program that'll put an additional $300 out to all the beneficiaries that are there. The surplus will basically be up to the legislature next year. I would say that the extrapolation of that number is pretty generous. We are not, that is an extrapolation of the high end of that number. We originally forecast a 14% reduction in income, and that's why we put in some of the things. We're still concerned about it, but we don't know where this pandemic is going. It's getting better, and we're going to do all we can to drive it better, but we think we ought to be cautious. But in essence, what's there in the surplus is something the legislature will address, the Joint Finance and Appropriations Committee and the entire legislature. But one of the things that is really important is that we maintain the solvency of our unemployment fund. Many states are now borrowing to do that. We've got the second most solvent unemployment fund of all 50 states.
Third question is, how would you characterize the unemployment situation in Idaho now? And and then part of that is, how is the Labor Department doing?
The Labor Department's doing a lot better. In their defense, the programs that they were handed were were almost impossible. Every state had trouble with them. A lot of these states, and we are one of them, had old systems that just weren't adaptive to those new programs. Our backlog is literally what it normally is. There's always a little bit of a backlog. But the new program that we're putting in place, Director Revere, we're working with our federal partners so that when those dollars show up, we'll be able to get them into people's pockets as fast as possible. So we had a lot of lessons learned from that, and we'll do some things in partnership with the legislature when they come back. But our unemployment system is working quite well now.
Scott said those are his 3 questions, but just because it's Friday, sir, one last question. How long will the special session last?
Long enough. That ends the Scott Logan press conference. Thank you all very much. Keith.
Governor, you mentioned Idaho Department of Labor released the 5% unemployment numbers today. Also, some other stats. We're closing in on 30,000 Idaho residents with the infection, nearly 300 dead. I know these things are all related, opening up the economy and infections being increased. Are you satisfied with how things are balancing out and playing out at the moment between, a good number, 5%, and those other numbers with infections and deaths?
Oh, no. One infection's too many. And of course, the overarching goal is, again, my graph, that the main thing is we have enough healthcare capacity. Idaho is not an island. If everybody in Idaho did everything perfect, all those things that we talked about, avoided large events, even if that was the case, as we've seen in other countries and other states where they thought they had everything controlled, because of the way the population circulates nationwide and worldwide, we're going to have some incidents. The lower that rate, the more confidence people are going to have to participate in the economy. And very important to me is the lower that rate, the more we can have schools back to normal, to where our children are in the classroom, and we're addressing that gap of learning gap that exists all the time. But generally, we knew when we opened up the economy that we were going to have an increase. We were hopeful that it was going to be a lot lower level. We like the trend, but it's just not fast enough, those numbers going down. So I'm not satisfied. Yes?
This week, the FDA approved 3 manufacturers' quick same-day COVID-19 tests. What is the state of Idaho doing to bring any of these new testing methods into Idaho to improve our testing rate?
And I don't know who wrote it. I read it. It was probably some of my incredible Idaho team. But having the test available is one thing. Having the reagents, the swabs, the mediums, the lab capacity, those are all part of it. So every time there's a new test that's available, we're excited about it. But we also have to be able to implement it. We had a good conversation this morning about something that's been an issue in Idaho for a long time, and that's reagent for our in-state high throughput lab capacity. And reagents, I talked to every time I talk to the White House, we had the FDA administrator here in town last week. That's critical. The new tests, and you can buy it at Albertsons now, they tell me, the saliva test, which has been proven out, is going to be a game changer, but it's going to have to be available. What would really help everybody would be a affordable, available, rapid test for business, for schools, for colleges, for all those people. Those tests are being approved, but having them approved and having the 3 different legs, which is the testing stuff, the lab to run them through, and the personnel are the critical things. We put additional money into our lab. Our lab that started out at, I can't remember, was 12 or 14 tests a day, is now, we're going to be up, we're between 500 and 1,000 a week is where we're trying to get to. We put money into pharmacies so the pharmacies could deliver testing, particularly to what we call our testing deserts. communities in Idaho where they don't have a big hospital or a clinic where they can do that. So the testing issue, we put more money into schools for testing, but again, I can give them money, but if there's not some place to process their tests, it doesn't do them any good. Every state's having this problem. We've actually even talked to some other states about partnerships and new lab capacity. I think, I don't know, but I think that as antigen testing comes on, the speed will increase, the time lag will go down, and the accuracy will be somewhat on a par with the PCR tests.
Governor, I have two questions here from Boise State Public Radio. This is from Rachel Cohen. During Southwest District Health's last board meeting, Board Chair Brian Elliott said members of the COVID-19 task force told him the district was not doing enough to reduce COVID-19 transmission. If the task force perceives this health district is not acting strongly enough, at what point would the state step in and issue orders for things like face masks and large gatherings?
Well, I read that report also, and full disclosure, Brian Elliott and I went to high school together. But I understand, I would characterize the conversation a little different, and we continue to do that, is we have discussions with the staff of the district, of the health districts, with the board members of the health districts, about what we see as issues. All this data that comes in that we look at, if we see those red spots on the map, and particularly, and most specifically, if we're concerned about that red line being penetrated by the people there, that in Southwest District Health has a little bit of an advantage in the fact that they're right next to Central District Health, and health capacity that runs out in Canyon County will naturally flow into Ada County, but that's really not very fair to Ada County when that happens. But I know that there was a conversation about our concern about basically some of the advice and counsel that board was getting from the state, from the health community there, but their numbers are coming down, not at the rate we'd like to have them, but we're serious about it, and at some point in time, I don't want to do that, but at some point in time, if I have to, I will.
Another from Heath Drusen with Boise State Public Radio. Will you ask all lawmakers to wear masks and socially distance? And since it's Boise law to do so, would you like to see Idaho State Police enforce the law if lawmakers break it?
Well, I'm sure they're all tuned into this press conference where I talked about distancing, hand washing, so I think I probably got the problem resolved. We'll see. The legislature, basically, particularly their part of the Capitol, is their jurisdiction. They establish the rules, they establish the criteria, and that's basically a constitutional separation of powers. Now the Capitol, the state police, and the staff that provides support for the legislature, there's been robust discussions about what we need to do there to keep them safe. I know that our staff, the Department of Administration, has been working with the legislative offices about what we can do to minimize those transmissible moments that are out there. I've had conversations with leadership, and they're very aware of it. We have some members of the legislature that even last March were very concerned, and some of those people may not show up at the legislative session, but that really is a jurisdiction of the legislature. They govern themselves. Clark, way in the back.
Yeah, hi, Governor. I got to say, even though he's not here, Scott's inspired me, so I have two questions if you're ready. The first one is, a big part of your message to Idahoans has been about coming back to school. The first school districts and charters went back this week, and I wanted to ask for your characterization on how it's gone, knowing that we've got some going back in person, some online, but we also have teachers that are in quarantine before their district returns, and entire football teams in quarantine. And this week I heard superintendents from Twin Falls and Lakeland tell your State Board of Education that they're concerned about staffing issues and having teachers available to fill the classrooms if other teachers get sick and have to quarantine.
And the question, Well, everything you said has got a large element of truth. There's a lot of uncertainty in this, and so I think the answer is it depends. Last week, a week ago today, I was in Lewiston, spent half a day with all the educators, the administration, the educators there. Yesterday, I was in Rexburg, Sugar City, and Idaho Falls, talking to educators there. Believe me, all these, every single educator I talk to wants to be back in the classroom, but a lot of them have a legitimate concern. But there are a lot of people that have legitimate concerns. Look at the people in the healthcare industry that clear from last February knew they were at risk about the people that are in the healthcare industry. And obviously the people in the educational community have just as much concern, and they should have. We want to keep staff at risk safe. We want to keep students, all students safe, particularly students that might be compromised. They might have asthma. They might have, they might be they might have some kind of health issue. So those are all fitting into it. Our school districts have all got kind of dynamic plans that take place. They're working with their health districts about where they are. We've seen school districts say, we're going to open, and then this morning say, well, we're not, for some reason. But I want the default to be everybody's open, but I also want the default to be at a certain point in time to keep your students safe, your community safe, and the staff safe. We can't. All the other things we're doing to get the spread down, to lower that curve, means that we're going to have kids back in schools. There's some really innovative things. In Idaho Falls yesterday, we've got some of those districts that have been online all the time anyway. And so what we're trying to do from the state board, from my office, from the State Department of Education, is take the best practices in some of those areas and get them out to those other districts so these kids don't fall behind, given whether they're out of school, whether they're being at home, whether they're being there part-time. Those are all part of the things that are in the mix. I forgot, it was so long ago I gave you such a long answer.
Just for Scott, if you don't mind. We didn't have a chance to be with you when you issued the proclamation for the special session. Could you go over the issues that are going to be under discussion next week and talk about any expectations you have?
There's actually 3 RSs in 2 different areas. And the 2 are elections are basically allowed, because there's going to be so many absentee voters that allows the clerks to, and they're not going to count the ballots, but they're going to get them out of the envelope, go through all the protocols to maintain the integrity of the voting system, line them up to put them on the machine, so when the election day's over, they push count and the count comes out, instead of maybe spending days opening up the ballots so we get the numbers back. The second one is voting centers. We all know that the general population that works in a polling place in precincts all over the state of Idaho is an older population. A lot of our precinct polling places were small places where there wasn't, you had too many transmissible moments when people came in and voted. So we're trying to address that by having voting centers where people can stay safe. It's all about the efficiency and protecting the electoral process and making sure that we don't discriminate against anybody that's health compromised. I would just urge everybody, if they've got any concern, to go to idahovotes.idaho.gov, get their absentee ballot. It'll be sent to them and their vote will be counted. The second one is on liability. That relates to schools. I've had a lot of school administrators tell me that they're concerned about the liability there. It's also some on the civil side for businesses. I've been concerned about that from the get-go. That one's going to be a little more interesting as the debate takes place, but those are the 3 different bills the special session is going to be about. Yeah.
Governor, what is your message to school board members who are opening up in the green category, even though the public health district that is working with them and offering them recommendations is telling them that your community's in the red and that really either the yellow or full distance remote learning is the best option? What's your message to those school board members who are doing that?
Well, it's the same message as I just talked about just a minute ago. I want schools to open, but I also want to keep staff, students, and the community safe. And what I would urge that those school boards do is communicate with their local public health boards about, what's the science, what's going on. We've got some, Canyon County is a good example. Look at all, Canyon County's part of a large health district, but there's school districts to where, I can show you an intersection in Canyon County where school buses from 5 different school districts go through that intersection. So none of them live in a vacuum. And in fact, we've got some counties where there is zero spread in that part of the county, but the county's in the red. Not very many, but I think Grassmere's pretty safe, but Homedale's a little different in Hawaii County. But nobody lives in Grassmere. Yes, Jacob.
Does the state have any plans to, publish the, positive tests that are being reported out of schools, as they're being reopened? Is that in the state's plan to just make that information public?
Does the state have a plan to publish positivity rates of, not, and maybe either Dr. Hahn or Dave or Elke could address it, but it'll go through our regular process. If somebody shows symptoms or gets tested and there's a positivity, then the health district through their contact tracers will say, this is where it came from. Are we going to do anything over and above that? Do you know, Chris, why don't you, I've been dying to get out of here.
Yeah, I'll just add. We've had a lot of questions, and of course we've been working hard on figuring out how to. We're a little challenged because school's already opened here. We've been looking at other states where they still have a few more weeks. And a lot of states are trying to grapple with what they will report about cases or outbreaks in schools. One of the challenges, of course, is deciding what that means if a single person tests positive to school. Is that somehow publicly announced? We don't want to get either cause panic in parents or have parents read in the newspaper that they didn't hear about from their school. So we need to coordinate closely with the schools, and we have meetings scheduled for actually still today and next week to kind of try to come up with a plan that we can all agree on how to do that. We want to be transparent, but we also don't want to have parents hearing about things different ways that they didn't expect or not understanding, well, what does that mean? Am I supposed to take my kid out of school now? Or so ongoing. I wish we were ahead of where we're at, but we're still trying to sort that out and get a final plan together.
You're back. You did such a good job again.
Dr. Hahn, I just wanted to ask you about this new criteria that was announced last time, the hospital admissions of suspected and confirmed COVID-19 patients. Wasn't last time higher than 4 per day, and now it's higher than 8 per day? Why did that change?
Yes, so we, the question, it was, if people didn't hear it, was about the metric about new admissions to the hospital. Yes, it was changed. You're absolutely right. The governor alluded to the fact that we are tinkering with and tweaking our metrics. And back to Betsy's questions, we acknowledge that our metrics were great, and I really felt like they were great metrics initially, but now things are changing, and so we're trying to make sure we have the right metrics. What we did last time was we just looked at some of the cases, and we decided to expand. The reason it's gone from 4 to 8 is we've actually added suspected and confirmed now, more closely mirroring the data we're showing on our website about number of suspected and confirmed cases in the hospital, that hospital burden. So it's to kind of match that a little better. So we had to raise our, I shouldn't say we had to. We decided to raise our threshold to kind of match that of having a broader group of people that we were looking at. But we acknowledge we're going to keep tinkering, so please keep asking those questions. We do want to, there are some of our metrics that we thought were great metrics, the ER data we talked about. Now people don't come through the ER as often as they used to, so we're finding that less useful than we found the first wave. The healthcare worker data the governor already talked about, we're finding that that's not getting, those interviews aren't happening quickly enough that we're seeing that in a timely manner. So that's why we're looking at the other hospital data. But that hospital data is still getting in every day, and we do want to rely on that more and more.
You probably want to talk to Dr. Hahn.
Yeah, I was gonna ask another question, Dr. Hahn.
Come on up.
I see that percentage of positive tests is not listed in the documents you gave out here. Is that still a metric that the state is tracking, or is that just a part of that evolution you were just talking about?
Yeah, I'm sorry, I thought it was in there, so we always, please, others let me know if it's somehow got left off, but we do, absolutely, to your question, is it in there? Okay, yeah, percent positivity, as the governor alluded to, we're happy to see it starting to decline. We continue to publish that every week on our website, and it's maybe buried in there with also the total number of lab tests that are being done. You got it now? Okay, perfect, yeah, very important metric, thank you.
We all done, Emily?
Are there more questions?
All right, thank you very much. Tell all your friends and neighbors to support the Idaho Food Bank. There we go.